Guys, today we're going to talk about the white coat killers and their hospital killing fields. It's a problem that not only hasn't gone away, it's really only getting worse in many, many ways as the bioweapon masquerading as a vaccine continues to be peddled on college kids and children and people. I saw people just the other day at the Target CVS pharmacy in my neighborhood sitting, waiting for their injection. And I could hear the pharmacist say how busy she was and that she had to go do a vaccine. Guys, I don't know what's going to change the brainwashing and wake these people up. I guess it'll be the casket. Dr. William Makis is back. He's a Canadian physician with experience in radiology, oncology, and immunology. He knows his stuff. University of Toronto scholar, author of 100 plus peer-reviewed medical publications, and an absolute truther on the side of humanity for which he has paid a heavy price. Dr. Makis, welcome back.
Thank you very much for having me again.
Well, thanks so much for being here. I want to share a brief anecdote about medical extortion in just 1 second, but let's lead with this story. And it's not even about the bioweapon masquerading as a vaccine. It's about the childhood vaccines. And this poor girl, the very young Lexi Lorenza, who went to the hospital because she suffers some, I think, blood disorder. And she went there for treatment because she was having a pounding headache and they refused to treat her unless she agreed to take the tetanus shot, the meningitis shot, and pneumonia shot all at once. They forced her to take those shots at Irvine Medical Hospital in California. And this is what's happened to her, folks. This is what's happened to this young woman. And they're not giving her any treatment. This comes from Nurse Erin's website. I know that many people whose names you know, guys, are all over this story because this poor girl is likely to die. So just a cautionary tale for parents. Not only do not give your children the mRNA bioweapon vaccine, do not give them the childhood vaccines, certainly not all at one time. Dr. Makis, this is a cautionary tale for parents. This what's going on with Lexi Lorenza is horrific.
Yeah, absolutely. Honestly, like with the COVID-19 vaccines, we saw just how corrupt the whole sort of field of childhood vaccines is. I didn't think they would come after the children with the COVID-19 vaccines. Initially, I just thought, well, they're going to give it to the at-risk population, which was at the time people over 70 years old, people in long-term care homes, people with multiple comorbidities. At least that's the way it was painted initially. And, then they roll it out in the broader population, which I thought was absolutely insane, with a brand new technologies, lipid nanoparticles, mRNA, which had never worked, had always failed. These are failed oncology technologies. And then they went after the kids, and I thought parents would stand up. They went after kids 12 to 19, and parents didn't stand up. And they just kept going lower and lower. And now, they've pushed as low as 6 months old. Now, this girl, she had this horrific reaction. And it wasn't from the COVID-19 vaccines. Of course, we're going to talk about, reactions that children are having from the COVID-19 vaccines in a bit. But, this is just an absolutely horrific reaction that she's had. They gave her, these regular childhood vaccine schedule shots. Now, they've talked about replacing all of the childhood vaccine shots with mRNA technology eventually. God knows what they're doing with it now, but you cannot trust any childhood vaccine at this point, and that's hard for me as a physician to have come to this point, having trusted the system initially, and having vaccinated my children, which I sort of regret at this point. But you could see that you could have a life-threatening reaction to the other childhood vaccines as well. And, I've gone over the VAERS reports, and it's shocking what you find there. The HPV vaccine, for example, you've got 15-year-old girls with ovarian failure. You have, 13, 14, 15-year-old girls and boys dying suddenly of myocarditis, cardiac arrest. That's all in VAERS. Nobody talks about it, but it's there. It's for the HPV vaccine. You could find it with the hepatitis B vaccines, DTaP as well. She had 3 vaccines in one, and she had what looks like some kind of a very severe acute immune reaction. That's what this is. That's why she has all this sort of this sort of bleeding. It's all this sort of purple that she has, this sort of subcutaneous sort of hemorrhages that she has. That's a very severe immune reaction to receiving, these three injections in one shot. And I think it really shows parents, the dangers. There's dangers associated with every single childhood vaccine. These are not, 100% benign, safe uh, interventions, medical interventions.
Well, it's so sad too, because at the conclusion of this particular post, she's predicting her own death within the next few days. She doesn't believe she's going to make it, and she's getting precious little help from that hospital. And so
Yeah,
people like Nurse Erin, people like Steve Kirsch, people are trying to intervene to call
right.
attention to this story to save her life. Now, the anecdotal story I wanted to share with you is regarding medical extortion. This goes back to when our oldest son was 11 or 12 years old, and he had a skateboarding accident, and he came to our front door with the assistance of a neighbor with a compound fracture of his forearm, and it was horrific. We took him obviously immediately to the nearest hospital, and we were told that they wouldn't perform surgery on him unless we agreed to him getting a tetanus shot. So your hands are tied at that point. My question to you is regarding medical extortion. How do we circumvent that? What are we, the people, supposed to do when we go to the hospital and they say, oh, you want medical care? Well, you better take these vaccines first. That's exactly what happened to Lexi. It's medical extortion, doctor.
It is. It's extortion. It is unethical. It's unprofessional, and we saw a lot of this during the COVID-19 pandemic. I think it was in some way normalized during the COVID-19 pandemic when doctors started refusing medical care to unvaccinated patients. I think Children's Health Defense is doing an amazing work with their series where they're interviewing individuals, whether it's nurses or family members of unvaccinated patients who are left to die in the hospitals because the moment the medical team found out you were unvaccinated, they basically didn't provide you with proper care, or they just put you on remdesivir, didn't give you proper fluids, nutrition, nothing. They just kind of rushed you to your death. So we saw a lot of this kind of medical extortion during the pandemic. My advice is, and unfortunately in these situations, I think you have to get a lawyer. And I think if you get a lawyer, of course it costs money, but if you get a lawyer and you push back, usually I think the hospital backs off, especially in the United States. They don't want lawsuits.